Today is Monday, March 30th, and we are continuing to serve those infected with the coronavirus and focus on keeping our staff, our physicians, safe during this pandemic. The number of COVID-19 patients did increase over the weekend, and many thanks to everyone to make sure that we had all hands on deck to care for these very ill individuals. So much has changed in our personal lives and how we operate this hospital. New processes, new safety measures, more messages, changing messages. It can get overwhelming, but I want to assure you that our command center, under the direction of Mary Bakken, is doing their very best to guide us through this crisis and help us make rapid and sometimes difficult decisions, always with the focus of safety. So, Mary, tell us a little bit about the command center. When did it start?
It started 2 weeks ago on March 16th. We had been preparing and monitoring what was happening elsewhere in the world and so forth, but it was after a call with the Illinois Hospital Association and with Governor Pritzker that we identified it was time to mobilize our resources.
Yeah, I remember that call seems like ages ago, but it was only 2 weeks ago. So I know the group meets twice daily, and what's your agenda? What do you discuss?
Everything is looked at through the lens of safety. Our patients' safety, employee safety, medical staff, and our community at large. Clearly, this is impacting our community. Yes. So we're very cognizant that we are an important resource to the community, not only for care, but for information as well. To be honest, the agenda changes each and every day. There's certain things that we attend to daily, but what we're wrestling with, what we're monitoring, changes a little bit every day. An example of that is last week, we modified our visitor hours further. So we tightened them up, we shortened them so that we're keeping a handle on the traffic in and out of our hospital and to make sure we're focused on care and that we're protecting people.
Yeah, that was a really good decision. We're following shelter at home, and the less people that come in here, really the better. What about personal protective equipment? How are we doing with that?
I consider us to be in a good spot right now with that. We monitor that, again, every day. Each type of supply, how many we have on hand, how quickly we're utilizing it. Now, we would like to have more, and we're always trying to secure more. We're pursuing every avenue, and we don't give up on those avenues. We're persistent on those. And our materials management team has done an excellent job of keeping us supplied to the state.
They really have. The hand-sewn masks that are coming in are proving to be really important because caregivers can wear them over N95s. Yesterday we got one, and there was a note in it that said, "With love, Maddie, age 13." So thank you, Maddie. Thank you for making us masks. You've gathered this team on a regular basis. What would you say are some of the most important decisions that the team has made lately?
It's so inspiring how this team comes together. When the command center meets, it's more than 40-some leaders that are connected in the command center, and many of them are remote because we're practicing, the 6 feet distancing rule. So we don't all gather in a room like we might have in the past. And all of the items the decisions that we look at or the things we're contemplating, we get great input, we make decisions quickly, and then we move right away to implement them. An example fairly early on was anticipating that we were going to need more negative pressure rooms. And so we came up with the plan to convert our units on 6-3 and 6-4 to negative pressure rooms. When the hospital was built, they were designed to do that. But we had never had a reason to do that until now. And then additional negative pressure rooms have been brought online in the emergency department and in 1-6. Another example of quick decisions is there's certain services we decided to close. Again, to try and help keep people sheltered at home. Anything that is an elective procedure, we are now postponing until it is safe again to do so and the shelter at home has finished.
Those were really important decisions, and thank you for your leadership with that. So you mentioned 40 people participate in the command center. That's a lot. How do you manage that?
It is a lot. We got our new rhythm down pretty quickly. I think because everybody understands we're no longer operating per normal in that capacity. We need to be very, very nimble, and everybody is invested in that. Everyone is doing their part.
You mentioned that we converted 2 units to accommodate people with COVID-19. Are those units full?
They are full. Like other hospitals in our area, we're seeing an increase in the number of patients that we're seeing that are COVID positive or that have symptoms and we're ruling out for COVID. And so, yes, that census is growing. We do have negative pressure rooms elsewhere in the hospital that we can utilize and are utilizing as well. This is something we closely monitor and why we're working on lab testing so closely.
I think also our infection prevention team is at the cutting edge of this. How are they contributing?
They are amazing. They are a small and mighty group of very talented and knowledgeable individuals. Of course, I think many in the hospital know of them because they have been educating us about the importance of hand washing, isolating for symptoms, and how to wear protective equipment. Now their role is ever more important. The guidelines, particularly as it's specific to this infection, are changing. And so they help us stay knowledgeable about what IDPH is recommending and what the CDC is recommending. Additionally, as there are exposures that employees may have in caring for patients, then they help guide us in evaluating that exposure.
And speaking of employee exposures, I'm sure employee health is playing a huge role.
Equally important in this regard, and really important in support for our employees if they've got questions about what they should do if they've been exposed, if they have questions about should I come to work, I'm having these kinds of symptoms, etc. Employee health has kept us up to date on all of that, including when specifically it is safe for an employee to return to work.
Yeah, very, very important. So, Mary, we're in good hands under you working the command center and keeping us all focused on what we need to do. But you must have some things that you're worried about. What are the things that are really on your mind right now?
I'm very mindful of the staff, our staff and medical staff that are taking care of patients right now and the challenges that they are up against. So I know that it is a very physical burden, an emotional burden, and in some cases for our staff who are not at work, a financial burden. So the resiliency and the health of our staff and medical staff is really what I think about the most. Of course, we're always looking at protective equipment and those supplies. We're working very, very hard now on securing faster lab testing capability and so forth. But I'm very, very confident. I'm so impressed, so amazed at how well the people of Silver Cross, our Silver Cross community, are coming together to face this challenge.
Yeah. Well, I share your sentiments exactly, and I worry about the same things. And your leadership has just been phenomenal here. And, Mary mentioned that we do have employees who have lost hours because departments have closed and we're not doing elective surgeries at this point. Many have asked us how we can support them. We do have an employee assistance fund here at Silver Cross, and if anybody would like to donate to that, we'll make sure that we get help to folks that are losing hours. It's run by the Silver Cross Hospital Foundation, and checks can be sent there if you're interested. But thank you, and thank you to everyone for keeping safe.